kick us off with our rate study work group. Our first meeting, we're going to handle some basic housekeeping things. We're going to do some introductions, go into some general information about the rate study, and then I'm going to turn it over to our subject matter experts and our contractor guidehouse to lead us through what the rate study is going to look like. So our agenda for today is, if you want to go on and go to the next one, is first we'll go through, as I mentioned, the welcome and introductions. We're going to go over the rate study work group, the overview and buildup of the approach, the cost and wage survey approach, as well as the topics for our upcoming meetings. So first we'll do the welcome and introduction. So we go ahead and I don't know, Kelly, what is the best way for us to do? Can people unmute themselves, or maybe is it better for you to go down the list for everyone and unmute them? So I'm trying to keep from kind of organized chaos so that we don't overtalk each other with introductions. So
yeah, I can kind of go down the list and call out names if that's easier. Okay. It looks like
so
it's kind of.
We've got everybody in. So if you want to, as you introduce yourself, talk about, the organization you represent, what your role is, how long you've been with that organization, and how much you've worked with our 1915C waiver programs.
Okay. We going through Guidehouse folks as well?
Yes. So let's do all of our rate study group members, and then we can do ourselves and then Guidehouse.
Okay. Let's see. So we will start with Amber, if you want to go ahead and introduce yourself.
Hey, can you hear me okay?
We can.
Okay. Well, my name is Amber Toney, and I am the Vice President of Adult Services for Easter Seals, West Kentucky. I've been with the organization about 17 years now. So I'm very familiar with all the programs, and I've worked in just about every program that we have to offer here. So.
All right, thanks, Amber. Next up, we'll go Amy Stade, since she's our group member. We also have Amy with the state, so but we'll start with.
Hi, sorry, I was unmuting myself. My name is Amy Stade, not Amy with the state, and I am the CEO of the Kentucky Association of Private Providers. We are a trade association whose members are providers of 1915C waiver services to individuals with intellectual and developmental disabilities. Our primary focus is on the Michelle P and the SCL waivers. And to a lesser extent, our advocacy also involves the HCB waivers, where some of our members do provide services through the HCB waiver. I've been in this role since July 2019, so I only got about 6 months under my belt pre-pandemic, but was a part of this rate study group in its previous form. So I'm happy to be here, and thanks for having me.
Thanks, Amy. Chris George, you're up.
I'm going to start my video too. Hi, I'm Chris George. I am a board certified and licensed behavior analyst. I'm also the owner and executive director of Applied Behavioral Advancements. We serve folks throughout the state through, I believe, all the waivers except for Model 2 waiver and some other funding streams as well. So we're excited to be here.
All right, thank you. David Craig. The name is not familiar, so I apologize. This could be someone who's not a member, but who is
David's with Guidehouse.
That's what I was wondering. Okay, so we'll go back. We'll come back to you. Diane, you want to go ahead?
Hi, I'm Diane Shermer, and I chair the Brain Injury Association's Kentucky chapter. I've been in brain injury for 30 years, and I'm involved at the state and national level in many roles, and have been happy to work in Kentucky for the last 6 years. I guess that's it.
All right, thank you. Let's see, Evan, you are next.
Hi, everyone. Evan Reinhardt, Executive Director for the Kentucky Home Care Association, and we have been involved for about the past 4 years on all things home care and the waiver programs in particular.
All right, thank you. Jason Squires.
Thank you. Good afternoon, everybody. Jason Squires. I'm the Chief Operations Officer with Cedar Lake. Been with the organization for about 23 years in a couple of different roles. We support roughly 250 individuals in the Louisville area, and we offer pretty much every SCL and Michelle P. waiver service available. We have another member of the Cedar Lake team on the call as well. We are kind of subbing in for someone who previously had been invited to the committee and is no longer with Cedar Lake. So we are trying to figure out who's the best person to have on the call going forward. So appreciate being at the table. Thank you.
All right, Jane, you're next.
Here we go. I'm Jane Stalin, the Executive Director of Neuro Restorative Kentucky. I have been with Neuro for about 9.5 years, and we provide residential services and day services for the acquired brain injury waiver. I actually have a daughter on the Michelle P. waiver, so I've been involved in waivers for a little longer than I've been with Neuro. And I actually have a background as a nursing home administrator and have worked with the Department of Medicaid and OIG for about my entire career of about 35 years. So I'm glad to be on the committee.
Hey, thanks, Jane. Marge, you can go ahead.
Hi, it's Marge Wall with Cedar Lake. Jason kind of already explained while we're here. I am the Senior Director of Finance and Administration, been here 8 years, and I'm voting for Jason to be on this group instead of me. Just kidding. Just kidding.
All right, Michelle Allen.
Hi, I'm Michelle Allen. I'm the Executive Director of the Kentucky River Ad and Area Agency on Aging. I'm representing our ad network. There's 15 of us that cover the entire state and do the PDS waiver. I've been with Kentucky River for 21 years. The last 3.5 as Executive Director, and before that I was the Chief Financial Officer. And I've worked with the PDS waiver since its inception in September 2006.
All right. We also have Senator Stephen Meredith with us. If he would like to introduce himself.
Yes, good afternoon. I am Senator Steve Meredith. I represent the 5th District of Kentucky, which is Meade, Breckenridge, Grayson, Butler, and Ohio counties. I came to the Senate in 2017. I presently serve as the Vice Chair of Health and Welfare for the Senate, and also I'm co-chair of Medicaid Oversight. Before my life in the Senate, I was a hospital CEO for 30 years, and I've been involved in healthcare for over 40 years and have served on various task forces during my time in the Senate, specifically the waiver redesign. So I guess that's why I'm here today. Thank you.
Thank you for being here. All right, Steve Shannon, you're up next.
Good afternoon, folks. Steve Shannon. I'm with CARP, Association of 11 or 14 Community Health Centers. We provide Michelle P. SEO waivers, some brain injury waivers as well. I've been involved, I'm at CARP 25 years, been doing waiver stuff for that whole time, maybe a little bit longer. Glad to be here. Appreciate the invite.
Thanks, Steve. And Susan, do you want to go ahead?
Yes, hello. Good afternoon, everybody. I'm Susan Taylor. I'm the director of the Lake Cumberland Area Agency on Aging and Independent Living in Russell Springs, Kentucky. We serve a 10-county area in South Central Kentucky. I'm starting my 14th year here at the Area Development District. I was hired in as a CDO support broker in 2009. So I've watched and been involved with waiver evolving and growing since that time. We're primarily HCB. We have had a previous experience with Michelle P. and ABL long-term care as well. I was involved in the 2019 rate study, and I'm looking forward to participating in this rate study, and so thankful to see this group of people together willing to put your heads together to make a difference.
Okay, and I think I ended up out of order. Mary, you want to go ahead?
Okay, this is Mary Haas, and I have been a past president of the Brain Injury Association. I can't talk today, but have been doing advocacy work since 1991, so I'll figure out how old I am. But I am delighted to be invited, but I think there's a lot of work to do, especially around the ABI waivers. As far as rates and all that. So again, I also have two siblings who had suffered brain injuries. And again, like I said, hopefully we can get a lot accomplished.
All right, thanks, Mary. I think I've grabbed all the members, but if you're out there and you're a member who doesn't work for the state, doesn't work for Guidehouse, and I missed you, just holler at me and I'll make sure to grab you. So we have a couple of folks from other state agencies on as well. With Dale, we have Marnie Mountjoy. Marnie, do you want to take a moment and introduce yourself?
Hi, thank you, Marnie Mountjoy with the Department for Aging and Independent Living.
Okay, we also have Claudia Johnson with BDAID. Claudia, do you want to introduce yourself?
Sure. Hi, I'm Claudia Johnson. I've been with the Division of Developmental and Intellectual Disabilities for 21 years, and I'm currently the division director and happy to be part of this group.
All right. Also have several folks from DMS, so I'm just going to run down the list. May or may not be alphabetical here. Just kind of depends on how y'all are popping up. Alicia.
Good afternoon. My name is Alicia Clark, and I'm the Assistant Director in the Division of Community Alternatives. And most of you I know, but the ones that I don't, it's nice to meet you.
Amy. I think you're good to unmuted if you want to go ahead.
I'm Amy Richardson. I'm the Director of Fiscal Management here with the Department for Medicaid Services, and I have been in the cabinet for almost 20 years.
All right, Steve Bechtel, do you want to go ahead and introduce yourself?
Sure. Good afternoon. My name is Steve Bechtel. I'm the Chief Financial Officer for the Department for Medicaid Services. And I have been with the department for over 20 years, just a little over 20 years now. And mainly my responsibility is budget and looking at the budget and maintaining the budget and verifying that we can provide the services under the budget that we have. So good to be on this group and look forward to working with many of you.
All right. Pam, we all know who you are, but do you want to go again? You're muted, dear.
Sorry, I can't find, I got so many screens up, I can't find it. So I am Pam Smith. I'm the Division Director with Medicaid Services over Community Alternatives. So I oversee all of our 1915C waivers. I've been with Medicaid for about 3 years, but prior to that, I worked with both of our vendors, with UM and our MMIS vendors. So I have been involved in waivers for the last 27 years. When I started, we only had 3 HCBS waivers. So we have added on both brain injury waivers and Michelle P, as well as starting the participant directed services option in the time that I have been with the waivers. I'm very excited for this group. I think we've got a great group of individuals. Also wanted to add that they were not able to join us today, but Representative Kim Mosier and Senator Julie Rocky Adams will also be participating in this work group, as well as Kelly Upchurch from CAD will also be joining us. He was not able to join us today. So Kelly, you want to introduce yourself?
Yeah, I'll go ahead and put my camera on. Forgive my funny headset. I have littles running around. So I'm Kelly Clace, Communications Specialist for Medicaid's Home and Community-Based Waiver Programs. I've been here about 4 years. Primarily, I'm here to keep the Zoom meeting running smoothly and to kind of disseminate communications to you all. So primarily, you'll be getting emails from me. That's kind of the biggest place where you'll see my name. So a lot of folks from Guidehouse on, so I'll go ahead and run through them as well. Elizabeth, I think we'll end up starting with you because you're at the top since you're doing the presentation.
That sounds good. I am Liz Kahn. I am a
Sorry, my video is not on. I'm a managing consultant here at Guidehouse, and I've been with Guidehouse for about 4 years. My background is in public health, and I've been doing rate setting in a variety of states. So I'm super excited to be here doing it in Kentucky as well. And I'll hand it over to Jay.
Yep. Thanks, Liz. And I'll just ask Jeff and Veronica to introduce themselves. But I'm Jay Bulott. I'll be leading the rate study project here in Kentucky. And a little bit about my background. I've worked in some aspect of home and community-based services since the 90s, whether it was in a geriatric psych unit or inpatient, outpatient. But I got my doctorate at UMass in gerontology. My emphasis is in research methods, statistics, and public policy. Was a tenured professor for several years at University of Louisiana, where I actually worked with some of your colleagues in Kentucky to develop one of the first accredited long-term care programs in the country. But I left the university to work in state government. I was a state director for aging and disability services in both Louisiana and Georgia, where I oversaw most of the waivers and long-term care policy, Medicaid, long-term and home and community-based services policy, and then joined Guidehouse back in 2016. In my state service, I was aging director, so I worked with Marnie. I worked with IDDD. I've been on the boards of the brain injury here in Georgia and Louisiana as well. I'm happy to be here, and I'm always available for any questions you might have. Let's go with Liz and then Jeff. Veronica and then Jeff.
Sure. Hi, everyone. My name is Veronica Ross-Cuevas with Guidehouse. I've been with Guidehouse for about 5 years now, and I typically work with state Medicaid agencies and HCBS programs, and have previously supported HCBS rate studies in other states. So I'm looking forward to working with you all here in Kentucky. Thanks.
Hello, everyone. My name is Jeff Moore. I'm a director at Guidehouse. I have spent my entire career consulting with state Medicaid programs and human services agencies. Bring about 8 years or more experience supporting CMS, helping them provide oversight of state HCBS programs, and have also, in the last 3 or 4 years, led a number of similar rate studies with other states. And so I'll be kind of serving as a subject matter expert for the state, the work group, and the team, kind of leveraging kind of the experience and insights that we have from CMS, as well as some of my prior and other ongoing rate study work with states. So looking forward to it, and a pleasure to meet everyone.
Liz, if you want to go on and go to the next slide. So this slide that you will see all of the states in yellow. Guidehouse has had experience where they have worked in some capacity with assisting with the home and community-based services. So there are over 20 states there. The states with stars represent states where Guidehouse has assisted with rate development. And so that is over 11 of those, or over 10 of those states, right? I believe it's about 11. So if you will go on to the next slide. So let's go over first just our overview. So why are we here? So you all are a very diverse group, very important group of individuals that we have asked to join us to develop rates across the waivers. It's going to support the initiatives related to the ARPA spending plan. It also, that spending plan is allowing us to kick this rate study back off again. We've contracted with Guidehouse for this purpose. Want to again reiterate that DMS is the decision maker, along with, we collaborate with our sister agencies. We are very thankful to have Guidehouse with their experience to help us with the technical support and for conducting the study and to helping us develop these rates. Why do we need to do this? We have to have a sound payment and rate setting methodology that is informed by a study. This is required by CMS. Even outside of having the ARPA, this being a requirement for any rates that we want to adjust through the ARPA spending plans. It's required by CMS to be included in all of our waivers when we submit them to CMS. So we are convening this rate study work group. It is the intention is to provide ongoing expertise throughout the entire rate setting process. We have a couple other individuals that will be joining us to offer a participant perspective as well. I believe that the charter was sent out to everyone with the invitation. Let us know if you did not get that when we sent that update out, and we will send that. But it really goes over the mission of the group. One of the updates we made in the charter is refining some language around information sharing and reinforcing the balance of being transparent while not sharing preliminary information. So let me explain just a little bit about that. These discussions will at many times will get very technical. While we want to be transparent and we want to share information with our other providers and our participants, we also want to make sure they understand everything that goes into those discussions. So sometimes you share a slide deck, some of it may not make sense. So what we are going to do, we will actually have a web page dedicated to all of the ARPA activities. So rate study information will live there. We will be posting regular updates after these meetings so that there is general information out there for others that are not part of this work group, so they will be able to participate as well. They're going to know what we're doing. Also, they're going to understand that as members of this rate study group, you may be coming to them to encourage them to fill out surveys, to ask for their thoughts and their insight on what they may see as problems or ideas that they may have, so that you can bring that back to the group. This is our first kickoff meeting. We anticipate having monthly meetings moving forward. Towards the end, we'll talk about that a little bit more and how we can set up what's going to work the best for the group. We can move on to the next slide, please. So our roles, again, in the composition of the work group. So we have representatives from small, medium, and large providers and associations. We include case management organizations. As I mentioned, we also have our waiver participant advocacy groups that will be participating. We try to have a diverse geographic representation. We've invited our legislators, so thank you, Senator Meredith, for being able to attend today, as well as having representatives from our sister agencies. So what is your role in the rate study? We want your input on how we do the approach of the survey, developing a pilot and a financial survey, your subject matter expertise and feedback on specific topics, the rate methodology and the process in general. And we also want you really to be the voice to reinforce to your peers the value of completing the cost and wage survey, as well as responding to any other requests for data. The next slide, please. So Guidehouse is acting in a supporting role throughout this process. They are here, as I mentioned, they are our technical expertise and experience. We will develop materials in conjunction with Guidehouse. The work group will provide feedback on those materials, and then DMS will be the final decision maker on those. There will be requirements for CMS and legislative approval for proposed rates. So this is a long process. We're asking for a lot of input and are very thankful that you all have agreed to join us. The next slide, please. So the services included in the study. So I'm not going to read through all of the services included, because you can see it's just about every service we offer. I want to talk a little bit about the excluded services and why they may show up there. Most of them, with the exception of occupational physical therapy and speech therapy, are services that get approved for like a certain amount of money. It may be a $2,000 a year or a $2,000 per transition. So we're looking at those. We will be looking at those to look at the limits to see if they may need to be increased or changed. And so we may ask you some questions about those. But as far as developing a specific rate, we are not they aren't included in like the wages survey. OT, PT, and speech, they right now only exist in the ABI waivers. They are transitioning to the extended state plan services, as well as looking at those in just in general. So they are not going to be included in the basic services in the rate study. We're going to consider if there's a new service that gets added or something that recently was phased out, the data and anything regarding those services, we'll also look at those too. So while this list, we tried to be very inclusive and make sure we got all of the titles there that made sense to everybody. It may be that a service may not look exactly like you know it in your waiver. Okay, so the next slide, please. So what have we done so far? So there's been a lot that's happened in pre-planning. We've done a lot of background research. We've developed what our survey approach is going to be to receive your all's input on that, looking at what services are going to be included, as well as we've submitted a new Appendix K modification that will give some short-term provider relief options while this rate study is in place. In March, so a day away, I guess, or tomorrow, we're looking at implementing stakeholder engagement activities, reviewing the draft provider cost and wage survey with the work group, finalizing the provider cost and wage survey. April to June is when we're going to focus on getting those surveys distributed, completed, and analyzing the data. For July to August rate development process, DMS approval of the rates. September to November and December is when we're going to focus on getting those legislative and CMS approvals. Public comment will happen during that period as well. And Steve, I believe I saw a question pop up from you in the chat about the previous rate study. So yes, and we Guidehouse will talk about this, I think, a little bit later, but we are going to use some of the foundational information that we got from the original surveys. We're not going to be reissuing that whole large survey again, but we'll be focusing on some specific elements. So I'll let Guidehouse speak to that in just a little bit. Actually, I believe, Liz, if you will, the next one, I'm going to turn it over now for Guidehouse to really talk about the approach and the rate build up and what is going to go into that.
Thanks, Pam. So as I mentioned before, I am Liz Kahn. I'm a managing consultant here at Guidehouse, and I'm going to be talking to you about how we actually go about building up the rates. So there are some federal regulations that govern rate setting and the rate determination process. The most prominent of which is the efficiency, economy, and quality of care standards. So those are these three standards that we will be referring to repeatedly throughout the next couple of months as we are developing rates, because we will need to show CMS that we are meeting those efficiency, economy, and quality of care standards. Also, the rates must be reviewed or updated every 5 years in accordance with the waiver renewals. In addition, states cannot claim room and board, and we need to be able to demonstrate that these payments are excluded. If we can't demonstrate that, that might open up Kentucky for a review from the Office of the Inspector General, which is never particularly fun. So we definitely want to be very clear about not incorporating room and board payments in our rates as we build them. And so those are just some underlying federal requirements that we'll need to keep in mind as we develop the rates over the next couple of months. So there are many objectives of performing this and all rate studies, but I really want to emphasize two objectives in particular. The first of which is that we are definitely aware of rapidly increasing costs, especially those related to wages that have occurred over the last couple of years. And we really want to make sure that the rates that we are developing are reflective of the reasonable and necessary costs that providers are experiencing in order to provide care. And in addition to that, one thing that has come to the forefront recently is demonstrating rate parity and rate equity across like services to make sure that for the same service, a state is not necessarily paying a vastly different amount under different waivers. And that's something that's important to CMS, and it's something that is important to Kentucky as well. So that's something we will definitely want to keep in mind. But really all of the things on this slide are really important, and these are all things that will come up as we are developing rates and as we are having these conversations this year. We'll want to keep all of these objectives in mind. So to develop rates, we have an independent model approach. So what that really means is that each cost component is independent of the other cost components. And to create those cost components, we really try to rely on a variety of sources. So that's the cost survey, participant acuity data, other state or industry or national benchmarks. And we really use all of that data to build the rates from the ground up. And so we tie that together like a puzzle and develop the rates. So once we have kind of all that data, which we'll talk about in a couple slides, how are the rates actually calculated? They're calculated using both direct and indirect costs. We understand that obviously direct care costs are a huge proportion of providing care, of delivering services. So we want to incorporate the cost of actually delivering the service and supervising the delivery of service. But we also want to incorporate that non-direct care cost component as well. So the administration or the program support, those are things that we recognize are essential for providing the services that you all provide. And so we need to make sure that we're incorporating a component for non-direct care costs as well. And then we basically add those together to get what the rate should be. So these are different, some of the components that go into that rate model that we just talked about, some of those direct care costs and non-direct care costs. And just some definitions that you all can read here. I'm not gonna read them to you. But we use a variety of pieces as part of the rate buildup. We use costs, time, our understanding of staffing patterns, and ratios. And the ratios are used for the non-direct care components because we look at what the ratio is of the non-direct care to direct care. So non-direct care to salaries, wages, and benefits, in order to understand the relationship between providing services directly with supporting providing those services. And so that is something we want to emphasize, that while we understand both are important, they get used in different ways to develop the cost. So as mentioned earlier, we really use a variety of sources to support rate development. This data really comes from a couple of sources. Obviously, the most important source is the cost and wage survey that Jay will talk about in the next section. But we also use other sources as well. And these other sources help to supplement the survey data. One, if we have trouble collecting that information, or It also helps to confirm the information that we receive from providers, and helps us explain why it's reasonable. And part of that goes into telling that story that we talked about before in terms of explaining the efficiency and economy pieces to CMS. We need to be able to say how the Kentucky data aligns with other states or national or industry standards. And so these other sources will help us tell that story. So it really helps us speak to those required standards. And I see a couple of questions or conversation in the chat. So it sounds like there's still some additional questions about OT, PT, and speech. So I'm not sure, Pam, if you wanted to speak directly to those services being included or not, or excluded from the survey.
I can. I believe, and I think that it kind of will dovetail into Diane's comment about that they're essential services in brain injury rehab. So I believe that while, and I agree that therapy services are essential in for the rehabilitation. The existing services, I think, have gotten kind of skewed away from being those rehab services. So while they are not initially included, I believe we still are going to be doing some review of PT, OT, and speech, as well as there's going to be some additional look at the brain injury programs and looking at kind of that neurocognitive and the neurobehavioral approaches and the additional therapy approaches. So they're not initially part of it, not to say that there's not going to be some review and discussions about those services, if that makes sense.
Perhaps if we would use data and program evaluation to look at how programs use therapy appropriately to show gains with individuals receiving those services, we could look at the balance of using therapy services when they're needed by individuals over their time period and age, when cognitive decline comes in place at various periods, so that therapy services are not based on where they are in a program, but on what they actually need. Because we know that brain injury is chronic, and we know that changes occur with that individual over time, and therapy services are not a one-time, one-shop thing for them.
And I would agree, Diane. And so that's why, and that discussion will happen better in a different overall, I think in a different group, while information from that may be shared with this group, but this is specifically, to look at the actual rates in that. But I hear what you're saying, and I agree with you. And it will be addressed, I think, in another part of the project, and that information can be shared with this group.
Thank you.
And I do see a couple of other questions in the chat as well. So from, are the inflation factors real time or historic? I think that is going to be part of some of the upcoming conversations that we will take back to this group. I don't think that is something that has necessarily been decided at this point, but something that we can consider with the help of this group, and part of the reason that we have this group to discuss. And a question from Amy: will the rate study consider wages that will be considered to be competitive across all sectors? So yes, I think that's part of the reason why we need to use this supporting data from other sources, like the Bureau of Labor Statistics data, since obviously that's not something that could be reported directly by providers themselves, but something that we can use to support our discussions of what wages we're ultimately going to use in the rates. But again, that's also something that ultimately will come back to this group, and we can have discussions about what you all are experiencing, what the providers are experiencing, and making sure that 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 the rates or the wages that we're incorporating into the rates make sense for going forward. Okay. I'm not seeing any other questions in the chat. Feel free to continue asking, but if nothing else, I will pass it along to Jay to discuss the cost and wage survey.
Thanks, Liz. You can go on to the next slide. So as Pam mentioned earlier, we're going to be doing what we're calling an abbreviated cost and wage survey. We've had a lot of discussion about some of the early work that was done on what makes the most sense given the changes that have been happening over the last 2.5, 3 years, and also informed by the other rate studies that the Guidehouse has involved in across the country. And what we've noted largely is that a lot of the cost data that was collected in calendar year 2019 when the last rate study was done in Kentucky, we're seeing in a lot of different states, those wage factors haven't really changed very much in the last 2 or 3 years. What has changed dramatically is the cost for employment, so individuals' wages, the benefits that are provided. Those are the areas that we're seeing the greatest, I guess, change differential due to the pandemic, due to COVID and the staffing shortage that's resulted kind of across all the industries. So in recognition of that, as well as the need to make sure that some of these changes that are necessary ongoing once we get through the pandemic are done in a timely manner, we can get CMS approval. It was decided by DMS and leadership to do that abbreviated survey where we rely upon the data from the providers in Kentucky from 2019, updating it where it's necessary to update, so we know somebody referenced inflation and whether we use real historical inflation factors. Those will be conversations we have within the work groups with you and leadership to decide what the best approach is and how do we update the existing data that was collected, and then how do we design the cost survey going forward to collect that information that's most important to capture that has changed in the last couple of years. The other part is this ought to be a much more abbreviated, kind of less burdensome process for you and the other providers out there, and that the heaviest part or the most strenuous part of the previous surveys have been all those other factors that are just kind of nuanced, and a lot of smaller providers just really weren't sophisticated enough or maybe understood how to fill it out completely. The other driving factor behind the abbreviated survey is that Appendix K is going to expire. And once that expires, the mechanisms in which the current rate increases have been done are no longer available. So we want to make sure that we're able to do something that's reliable, valid, represents the true cost of services, and that we can submit to CMS in a timely manner to make sure that we're able to actually offer the new rates to providers to cover the true cost of services. You can go to the next slide, Liz. So this is just a high-level overview of the data that we will be collecting and over the next couple months, and what we will be relying on from the old survey. So obviously wages for your employees, for staff, for supervisors, the benefits that are being offered, supervisor costs, and then we have this other category. And we know in discussions with DMS, with leadership, and even our experience in other states, that there are other cost categories that may be new categories that didn't exist prior to the pandemic that may need to be sustained. And those are kind of those topics that we want to work with the work group on to figure out what specifically do we need to include that's a new cost to operating your businesses that didn't exist in 2019. So we kind of have that other category to capture that, and we'll work with the work group as well as leadership to define and include those in the new survey. What we will rely on the old data, and we will update statistically with kind of more recent data to adjust the productivity information that was reported, the billable versus unbillable time, admin cost, program support cost, and we have occupancy as kind of some examples, transportation, equipment, supplies, and facility costs, recognizing that some of those really haven't changed, but others have due to COVID and due to the pandemic. And again, those are conversations that we'll have on, do we need to move any of those to the cost survey that we're going to be doing in the next month or so to make sure that we capture everything and have the most relevant information to what business is like today. Next slide. Liz, let me know if there's any questions that I need to answer while I'm doing this. Can't really.
Nothing as of yet.
Okay. So some of the survey topics, and again, let me reiterate that, the survey will be developed in coordination with this work group. But some of the topics that we know will be included, and we'll ask the providers, and that some of those are you, to fill out, obviously, to provide information. So who are you serving? What does your staffing look like? What are your service areas in rural, urban areas? Anything unique about the services you offer that need to be considered? What specific services? And then we're going to have and again, this is to be discussed within the work group, because there's different ways that we could approach collecting the wage and cost data. Is doing an annual, or doing a snapshot, or doing a quarter, and we'll just working with you and DMS and leadership define what time frame we're going to be looking at when we ask for this data. We want, based on our experience, what we're hearing, what DMS is hearing, that we don't want to go too far back because it may not be relevant. I think the labor shortages have increased pretty significantly in the last 6 months. And if we did an annual, it may water down what that might look like. But again, that's kind of a group discussion for our next work group. What turnover looks like, how many unfilled positions you have, and then what benefits are being offered. And just recognize that, we're going to be also using kind of the national data, some regional data, BLS data, to benchmark what other businesses and entities that are providing either similar services or compete for the same labor force that you do are offering, to make sure that we're able to be competitive and able to offer the services that are needed by the consumers to be able to stay at home in a community. Let's see, next slide. Yes, and inflation is a huge factor. The tricky part on that is whether, and again, these are kind of, I'm not going to say they're group decisions, but they're decisions that will be informed by group discussions, is how much of it's going to be, do we know is temporary, and how much of it is permanent, and how do we build that in? Because we don't want to build in some short-term temporary costs that may not exist in 3 years or 4 years. So those are just some examples. Timelines, as I mentioned, and as Pam mentioned, this is a very structured process, and we need to go through certain steps and processes in order to get to a point where we have data that can be submitted to CMS for their review and approval. And I think it's worth reiterating that, the rates have to have a valid methodology. CMS is going to review those to make sure that they are fair rates, that they cover the cost of services, and will allow the individuals who rely on these services to get quality services going forward. And they're looking at it through that lens. They don't want to see rates that are overly generous without being a justification for why, 3 times the rate is being paid for one particular service versus another that may be not paid for by Medicaid, because obviously CMS pays the brunt of the long-term care bills in states. But we also have to build in opportunities for public comment, for review, stakeholder review, for this group to review, and then for DMS to make the kind of the final guidance on the methodology and structure, and then submit that to CMS for their review to get back to us and either approve them, or if there's any questions that we did provide additional information to them. And then finally get it into the new rates once the Appendix K expires. So our goal is to have the abbreviated cost of wage survey finalized with this group, and then release it sometime in April, and to allow approximately 30 days for providers to respond to it. And this is where it's a kind of a all hands on deck approach. DMS is going to be pushing notices out to all the providers to fill out the cost of wage survey, submit it. We are going to be working, and we need this work group to really be involved to help get the word out that we need all the providers, as many providers as possible, to fill out the cost of wage survey, so we have a good representation of what the true costs are. Because if only the more efficient providers provide services, for those of you who have maybe a larger overhead, it's not going to be enough, and you're not going to be able to provide those services to people who need it. If it's only the most costly response to the survey, then others, we're going to be paying over than what CMS might allow. So we just have to be encouraging our peers to be active, to respond to the cost of wage survey. The other thing that happens around this time as well is Guidehouse in partnership with DMS will be offering numerous trainings for the providers on what the data points look like, how they fill it out, what's meant by, direct costs, wages, anything that might have some questions. We'll be manning, kind of the frequently asked questions and emails and everything else to answer provider questions to support as many as possible to fill out the survey. Next slide. Pam, did you want to cover this one?
I can start again. So just to kind of reiterate what Jay did on the slide before, our next steps. So we're looking at March at looking at this group's review of the draft survey and talking about what our best outreach approach is going to be. The finalization of the survey will happen in March, targeting distribution, doing training. And that's going to look like similar to what we did last time, where it can be, we'll have a larger training on how to complete the survey, but also we'll offer those kind of one-off training sessions if there's a provider that kind of just needs some little extra help, or maybe starts it and has a question. Tight turnaround timeline. And we realize this is also it seems like this happens every time, as we fall in the middle of tax season as well. So we will try to offer flexibility on that, but realizing that each step, there's a dependency for the next step on the one before it getting done. So we're going to try to stick to our timeline as much as we can. Then we're looking at May and June for looking at reviewing the surveys, analyzing them, and then sharing that information with the work group. So let's go to the next slide. So just to look at what our next meetings are going to look like. So in March, we're going to be reviewing that draft survey, getting input on the stakeholder engagement, education, external data use, what data needs we have, what's our communication approach going to be. In April, we're going to talk more about the model assumptions. And that's also why the surveys will be at the same time. We'll have providers as well as some of yourselves will be completing that survey. In May, we're going to review the results, look at our key takeaways, look at the wage and benefit model. In June, we're going to continue talking about that. We're going to talk about the key model assumptions from the previous rate study, looking at those program support cost factors, overhead. July, again, continuing to look at the data and what the results are showing us. And then by August, sharing the final model results, overall takeaways, and what the next steps are for waiver amendments and public comment. So, and for this slide, so we've established that email. Some of y'all may be familiar with this email address, that chfs.ratestudyworkgroup@ky.gov. Want to use that for all of our communications. That will allow it to not get bogged down in anybody's email, and to make sure that we are able to respond timely to any inquiries that we give, or any inquiries we receive. I'm sorry. And then the next slide just has some contact information. We will share this deck. I know there was some questions, so don't feel like you have to try to be, write down all of these names and emails. But of course, I think everybody has mine, but put it on the deck again. But you also have our Guidehouse partners. You've got their email information, as well as we've got that rate study work group mailbox out there again. So we kind of powered through that presentation in about our first hour. So this gives us some good time to hear some feedback from you all. We can answer some more questions that you all may have, as well as we can talk about the best way to determine, for you all, whether it's us sending out a quick survey after this meeting, kind of trying to establish a date and time for those next meetings, so that we can everybody can have that on their schedule. And I know schedules fill up fast, and it's easier the more advanced notice you have. So looking at what our date and time will be for our next meetings.
And Pam, I'll just make a comment as people think about that. On the topics, let's go to the topics for upcoming meetings. This is obviously a best case scenario. Topic items likely will change. So remember, this is a work group. So we're going to be working in these meetings. And if we identify something in March that needs further work, we will obviously add it to the agenda for the April meeting, and then we'll be all of us, the Guidehouse team, DMS, as well as many of you may be asked to help us kind of investigate, explore, figure out what's going on within our different provider groups of folks that we work with. If something's being discussed and we're trying to figure out, is this really something that's affecting the entire industry? Is this something that's unique to, some particular programs or some populations? And then so it's a kind of I guess, a living, breathing agenda where, it'll change as we're having discussions and as we're working through the various aspects of the rate study.
Thanks, Jay, for that important clarification. I think you all should be able to unmute yourself if you want to ask your questions live. You can put them in the chat, but we really want to encourage, we want this to be a very dynamic group and encourage you all to, please ask questions, give feedback. It really is, your all's meeting is as much as it is our meeting. It's very important for us to hear from you all. We're going to rely on this group a lot to, you all are out there doing this work every day. So you're going to have important feedback for the group, and an important role in this getting done correctly and getting done timely. So thank you again for your participation.
Question, Pam, this is Jane. I just, when you're looking at the new rate study that's going out in that other category, is that the category that's going to pick up all of the bonuses we've had to pay out, all the overtime we're having to pay out, just all the dollars that we're spending to just get staff to show up, and then that additional dollar we're spending to get them to show up and working positive COVID houses? Is that where it's going to fall? And then my next question would be in using the information from 2019, I would just say I think we need to be cautious, because I think every category you mentioned in there has seen an increase. Maybe not as much as my direct support staff labor, but every time we lose an employee, it doesn't matter what position they're in, we have to pay the replacement more. So that's my question for now. Thank you.
Liz or Jay, I'll take that as far as the other category, and if that's where that would go, or
So I'll take a first stab at it, and then Jeff and Liz, I'll let you kind of clarify it. I think it's up, well, as a work group, clearly that would be captured in one of the wage cost expense categories. I don't think it's necessarily captured in your standard wage categories. It's likely a supplemental that we'll ask. And I know, Pam, this was some of the questions that we were exploring a little bit in that survey that was being developed for the providers to capture some of those costs as well. I think we need as a work group, discuss, is this a trend that's happening across all providers, that they're paying overtime, that they're paying, additional startup and replacement costs for employees. I actually recently spoke at a provider conference here in Georgia for a group of providers, waiver providers, and about a third of them, when I asked about overtime pay, were paying overtime pay right now. So it's something that, it needs to be captured in some form or fashion. How that's addressed within the ongoing wages, I think, it's something that, needs to be considered, especially while we're in the midst of, and then as we recover from the pandemic and things get back to a normal, and we actually know what that normal is, because I'm not quite sure when we will know that. But yeah, so I guess the short answer is likely the other is just on that page as other. It will be broken out into individual lines to capture costs. So, and it might be 3 additional lines. It could be 8, 9 additional lines of kind of cost categories that we as a work group discuss and include on the cost of wage survey, the abbreviated cost of wage survey. I'm trying to remember the last half of the question.
It was just about the use of the 2019 information.
Oh, yeah. Yep.
And the increase in just overall cost.
Yep. And so that we've actually had a fair amount of discussion internally with DMS about this. So our goal is to make adjustments as much as possible to the existing, to the previous wage study, rate study that was done. And as we have good solid data that we feel we can rely upon, manually adjust what was reported last time based on inflation factors, based on if there's real estate costs that we know that have changed. And then what we want is, as providers have some unique experiences that either us as Guidehouse haven't seen in the other 10 states that we're doing rate studies, or I've done rate studies in recently, that we want to have an opportunity for them to share that with us, to see if it's worth considering to include in either the study that we do now, or in some way that we make adjustments for different parts of the state. Similar to how it was done with the when they did the tornado adjustments with Appendix K in Kentucky. Some providers got a rate increase or an adjustment to help shore that up until recovery and things got back to quote unquote normal there. And then, and again, I mean, that's part of the work group, is to help us validate, is this something that we're seeing, across the state that we need to build into the rates. Jeff, Liz, do you want to add on to anything?
Yeah, Jay, I would add that as it relates to kind of the historic costs, is Liz kind of hinted at kind of doing the high level overview, the rate buildup approach, is that a lot of those kind of indirect or administrative costs are, when we do the rate buildup, are based on a ratio between the indirect and the direct. And so we're kind of, what we've seen in some other states is that ratio, even through the pandemic, has tended to stay the same, but that it's driven, that ratio is the kind of costs, if you will, that are allowed for administrative and indirect are really kind of based on those wage costs. And so, as we expect to see wage costs go up, even if the ratio stays the same, kind of the associated administrative costs, kind of based on how the model works, would increase as well. And so kind of the underlying assumption is that the ratios, kind of their relationship with each other, stays the same. We recognize that some of those indirect costs may have increased over time as well, but kind of what the model will do is kind of adjust for that based on kind of the increase in wage assumptions that will go in. So again, these are all things I think as we kind of collect data and do the analysis and share it with the work group, it'll become more apparent. So
I'm not sure what fantasy you live in, but we've been living in the reality with programs across the country where we have programs closing and can't afford to keep direct support staff, let alone administration. So whether you talk about Kentucky or you talk about Georgia or you talk about California, we're all suffering with trying to keep staff on board and managing to keep administrative people there to handle the programs. So wages are through the roof, and so is overtime. So I don't think we should not predict that we're going to have costs in order to keep residential programs open, whether it be brain injury or IDD or severe mental illness. We're seriously talking about losing programs and not having places for the individuals that we have cared for years, not having a place to go.
Yep. And Diane, I don't know if you read I'm trying to remember the report. Every state has experienced at least one HCBS provider going out of business in the last year. And that's kind of at least one. So it means many of them have seen more than that. So so the goal of this project, is to make sure that the rates are able to sustain the providers, so they're able to be successful and continuing to offer the services. That's ultimately the goal of this, and CMS's requirement around this. They don't want, as this has been historical, and I've worked in states where this was the case, the rates were kind of I'm not going to say a fantasy, but they weren't really tied to what actual costs were, and providers were just doing it because they have a passion for it. But CMS expects that the rates pay the full cost of what it costs to deliver those services.
Yeah.
Hi, I have a question. This is Amy Stade. Actually, I have two questions. Number one, how will the increased residential, the ABI residential and the SDL residential rates that have been paid since, I believe, March 2020, that 50% rate increase, be accounted for in the cost survey? Obviously, that rate increase has allowed residential providers to slightly increase wages and to pay the tremendous overtime costs. My second question is, how will the rate study ensure that providers are able to pay competitive wages? And what I mean is, historically, when we've done this, we've compared DSP wages to other DSP wages nationally and in Kentucky, right? But DSP wages are low nationally. And as Pam has mentioned, and she testified to this in our 1915C task force, people like vet techs, our sanitation workers, Amazon employees, McDonald's employees, all of those companies are able to offer much higher, much more competitive wages for a lot less stress. And so how is this rate study going to account for those other sectors that we are competitive and losing to right now?
I just want to jump into Guidehouse team before we answer that a little bit more. Just say, Amy, I think that's why we have pushed the rate study, that it is so important, understanding all of those factors versus just applying, an across the board increase. Well, we realize, yes, you can look at, in Kentucky, you can look at other states. You can look, we had a workforce crisis. We had these issues prior to COVID. COVID has highlighted all of that. So while it's there, I think this is, for any of you all, I think that have seen some of the comments that have reflected, that DMS advocated and said we didn't believe there needed to be a provider increase. That absolutely is not the fact. We just want to make sure that we do this correctly and that we don't just apply an across the board increase without looking at that, because who's to say what the right percentage is? And, we need to understand all those factors to make sure we're getting it right. And so that what they're getting, and that it's the same across all the populations. So that there's not that disparity, but that also we are paying for high quality work. And yes, that the one quote that you referenced was from one of our HCB waiver individuals that referenced that individuals who in Jefferson County pick up garbage are able to pay more than he is to pay his attendant care worker.
Yep. And I'll just say that, and I just maybe want to just reference the flat rate increases. So as part of the ARPA funding, and it's not necessarily, it's tied to this, but it's not the rationale necessarily for this. CMS has advised states that, flat across the board rate increases aren't going to be allowed. You must have a methodology that informs it. And in some of the states that we worked with where that was the initial goal was a flat rate increase. When we looked at doing that versus a rate study, some providers, they would have needed like a 200% increase in their rate in order for it to cover the actual cost. So a 10% or a flat across the board rate increase would have done more harm than good. So, and I think that's the value of CMS requiring us to make sure that for those providers who need more than a 10% because it's been historically underpaid based on the roles, the responsibilities of the staff, that the rate should be able to pay that. And Amy, to your point about the kind of the labor force and what we're competing with, I think that's part of using the other data and not relying totally upon just to provide a data, because what you're going to get there is just this underreporting of what the actual costs are, because they're only able to pay what the rate's able to pay, to allow them to pay, and not look at what the labor force costs are in those areas to be competitive, to be able to get the best employees that you can for what I guess the rates that are available. So that's rationale on bringing in BLS and bringing in other competing data, private sector data, for example, who has more ability to pay competing wage or competitive wages based because of their funding mechanisms.
Yeah, Jay, this is Jeff. I would add, I think I led a similar rate study in Illinois, which wrapped up maybe a year plus ago, and this was a big topic of conversation. And as Jay said, in terms of, yes, you can measure what we're paying, but it's not enough to attract the type of workforce that we need to provide these services. And so we spent a lot of time with a similar work group there, identifying, through BLS and other sources, kind of what for similar types of job categories in the market, kind of what those industries are paying, and the Amazons and those things came up as well. And so those were all very good data points, which informed kind of ultimately what the kind of the wage levels were that the work group recommended going forward. So this is I think point being, this is a challenge and an issue that we're seeing in a number of states as they go through these studies, and we're well versed in how to get to that kind of competitive wage determination.
Pam, this is Steve Shannon. Other conversations I've been in over the years, the assignment's been you can do what you want, but it has to be a budget neutral approach, meaning there won't be dollars added across the waivers. Is that the case here?
So no, so there's a difference in, so let me approach budget neutrality in two ways. So the one way,
not budget neutrality, budget neutral.
But neutral, yes. So we will not, this rate study does not have the limitation of being budget neutral, where we have one pie and we have to move the pieces around in it. This rate study is being done with actually looking at what do we need to do with the rates and making that increase. So it's not in the same, it does not have the same limitation that the previous survey did, or the previous rate study did.
And if the rates go up in the second year of the biennium, will there be money there to make that change, or do you have to go to the General Assembly for an appropriation?
Steve, I will let you, if you're still with us, if you're able to answer that. If not, I can.
We may have to go back to the General Assembly for appropriations. It really depends on the where we go to from here, and the size. Now, we are getting the 6.2% FMAP right now that we may be able to, if they approve it for another quarter, which was not in our budget request, we may be able to use some of those funds to kind of offset, but it really will depend upon where we go from here, Steve, to be honest with you.
Appreciate it. Thanks.
Hey, this is Chris George. I know, having had the pleasure of participating in the last rate study work group, as long as some of the waiver redesign and those things, as many of you all were, good to see back. I know that we had a lot of discussion because currently similar services across the 6 different waivers that we have are paid at different rates. Some of the discussion that we had last time came into the administrative burden and the requirements of a specific waiver that was different from another waiver. So obviously ABI is different than Michelle P, SCL, and some of those rates across similar services vary across those. And the discussion was looking at the administrative burden across, and there was some goal because both of the rate work study work group, as well as the waiver redesign, were going on concurrently with the ultimate goal of having similar things across waivers so that then those services could be standardized as well. Since this is just a rate study work group, how are we going to incorporate differences between waivers and administrative regulations within those waivers and account for those costs?
So, Chris, you hit my pet peeve, which my team gets so mad at me when I talk about this, but I cannot stand, and it has been a goal of mine, and I will get it done before I leave this position, is the inconsistency among the waivers for like services. So we are working on independent of the rate study. We're also, because they're going to require regulation changes, the rate study itself will, the change in rates. We're also looking at those efficiencies, looking at, requirements both for, we even vary in education requirements for people that are providing the same service based on the population. And while there may be nuances with training, like if you work with somebody that has an ID or you work with somebody that has a brain injury, you may have there may be some pieces that make sense to be different. You may have some specialized training, but case management is a good one. We expect the same out of all of our case managers. The documentation differs greatly amongst all of them. Same thing with behavior supports. Documentation varies. It doesn't make sense. So we are also working to make those be more similar. So that, and I think that ultimately helps with your employees too. And it's a discouragement right now to provide more than services in more than one waiver, because as you know, since you provide them across every waiver except Model 2, you have to know which one you're working in to figure out what your documentation needs to look like or what your requirements are. So yes, that still will be a very, very important part of this.
Amen. And thank you. And just on a side note. So like the CEU requirement in the ABI waiver for 6 hours of CEUs greatly increases cost for staff support, training, ongoing maintenance relative to any of the other funding streams that we have. So again, I know that there was a lot of discussion last time. There were questions that were asked about, would this be, and I'm like, well, I don't know that I can answer that until we know what's going on as far as what the regulation itself says will be required. And I know we had kind of a cart before the horse, egg before the chicken, or chicken before whatever, the analogies. We had a lot of those as far as how they went. So I want us to have that as just at least a bullet point moving forward, that there may be some of those things that we run up against going like, this rate is great as long as this chunk over here in this particular regulation is removed. But if this one stays here, even though it doesn't affect the others, then I've got to argue for a different rate because of what my costs are. So as we look at the waivers and similar services applied across waivers, it is not always comparing apples to apples.
Right. Yep. I want to, Pam, I want to respond to just provide a little bit of clarification for Amy.
Okay.
So Amy, the neat thing about doing a true kind of a rate study the way we're doing it is based on the current cost. It's not based on what the previous rate that Medicaid pays was, because again, remember that especially given the past 3 years, it probably isn't a sufficient rate today. So if the providers are operating with a 20% rate increase or 10% that's been done, and they've been able to pass some of those wages down to their employees as well, when we do that, whether it's a 3-month or a snapshot of 1 month or the last 6 months, whatever approach we decide here to take, it'll be based on the most recent wages that they've been able to pay and retain employees. So it may be that much more than a 10% is needed, but we're not starting from the previous rate. We're starting on what the true cost is to deliver that service. So it's kind of, and that's what I referenced as an independent rate buildup. And if we were doing a simple, if nothing changed in the last 3 years, doing a building off of the last rates and what they were, that's fine. But because of the wages, those were the biggest changes. We want to do those kind of fresh. And then the ones that we don't think, and again, we'll make that decision as a group with DMS involvement and guidance. Those that haven't changed very much, will adjust those based on, the most current market rates for, for whatever those factors are. But it may be that there aren't any. We'll have to add that to a survey too. So I want to qualify that, we have some ideas about what the best approach is, but this group will help us flesh those out and validate that it makes sense to still do it that way.
And Jay, I want to go back and grab, I think Steve, you also had a comment about an interval rate increase while doing the rate study. We submitted a modification to Appendix K last Friday, or not last Friday, like a week ago last Friday. On Friday, late Friday afternoon, we received some comments or questions back from CMS and requests for some changes. But part of what is included in that is some provider relief, some short-term provider relief options. So I don't want to share a whole lot of information just because I don't know what CMS, their final decision is going to be. But we'll be sharing soon on that as soon as we get the information. I'm hoping they've really have made priority at reviewing those and usually get them turned back around to us rather quickly. My goal is I'll have that back to them either by later this evening or first thing tomorrow morning with their the changes they requested and the answers to their questions. So I'm hoping that very shortly we'll be able to share with you all what all that includes.
That's good news. I appreciate that, Pam. But earlier it did say Appendix K will expire. What happens then if this isn't done?
So
I think Dr. Bullock made that point.
Well, part of I think part of why you see such an aggressive time frame is for us to, we have, so the current end date for Appendix K is 6 months after the declaration that the federal public health emergency is over. We then have 6 months to transition back to regular services or what our normal, was prior to Appendix K. So we're looking at, what do we do to try to get those to marry up as close together as possible? I have quit predicting when we're going to see any kind of end to the public health emergency because it just seems to be the gift that keeps giving. So, it's something we're going to watch closely and see what we can do. But that's part of the reason for such an aggressive timeline for this rate study as well.
Okay, thanks, Pam.
Mm-hmm. Okay, so I realize time is very valuable for everyone, so I don't want to hold anybody hostage. Or Guidehouse team, I don't know if there's some additional questions that you all would like to ask or any feedback. I think maybe the easiest way for setting the upcoming meeting, picking a day and a time, I'll work with Kelly and we'll send something out to everybody on the work group, kind of just a mini survey, and we'll try to pick what works the best for everyone. We will get the deck shared. As soon as we have the web page developed, we will share that information as well. There's some other documents that are going to be coming out. We'll be sharing a lot of information over. I think I reviewed a few things this morning. So over the next couple of weeks, there's several documents that are coming out, but they'll also get posted to that web page as soon as we have that up and going. So yeah, so Amber, we will send a copy of the deck out to everyone as soon as this is over.
Hey, Pam, it's Amy. I have a quick question.
Mm-hmm.
those of us who are with associations, obviously, I understand completely that you don't want some of the nitty gritty to be shared, but is it appropriate and okay for us to share, like there is going to be a rate study, you can expect communication about it, to prepare folks about that?
Yes, I believe that that is appropriate. I think it's appropriate for them to be able to share information with you all to bring back. What we don't want to be shared is when we start getting into really looking at the rate components, and when you really get into those technical details without hearing it from the experts, because I'll tell you, it's finance, math, and it's just stuff that's better left explained by experts and people that do that all the time. So it loses its context, and I think sometimes it can promote just concern or fear when there's not really a need for it, just because maybe somebody doesn't understand. But yes, you can let them know there's going to be a rate study. You can let them know that you're on the rate study work group. You can, let them know when we share what the web page is, share that with them. There'll be questions that we, may send out to you all. Please collect this from, people in your association or in your provider advocacy group. So we're focusing a lot on transparency this time, but still realizing that there are some pieces that unless you are intimately involved in it and hear the true explanations, that it won't make sense, and it may cause somebody to worry unnecessarily. Does that answer your question?
Yeah, it does. Thank you so much. I appreciate it.
Right, so we're about at 3:30, unless anybody has anything else that they want to discuss. Guidehouse team, if we have anything we want to discuss, I believe we can give individuals some time back today. Thank you all so much for your participation and for agreeing to be on this very important work group. I think that there are several of the waivers that have not had an increase in over 15 years. So it's definitely needed, and it's an important project. So thank you so much for your agreement to be a part of this.